notified. We're going to resume recording now. So we're back in recording. Again, now that we have 115, 116 people on this call, most of the track represented, I want to say thank you for all the effort you've put into this weekend. It's been incredible to see where the team started with the problem pitches on Friday night to what we saw this morning, and I'm very excited to see what we're going to see this afternoon. The pitches today will be in English. I know many of us speak Spanish, most of us speak Spanish or Portuguese, but not all of us, and not all of us speak both languages. So we're running the event in 3 languages, but the primary language is English, and the pitches are going to be in English. So with that, first, let me remind everyone, we are in track A. If you're not in track A, please feel free to exit the Zoom room and look for the appropriate track channel. You should find those, and they should be posted in Slack. The presentations are going to be taking place between now and 3 p.m. Eastern Daylight Time, meaning New York time. So we're going to be doing this for the next couple of hours. Hopefully, we're going to try to wrap up as soon. We're going to try to move as fast as possible because we have a lot of amazing teams, a lot of great presentations, and I'll be pretty strict with time. I will be keeping time on my phone here. I will keep the 3-minute presentation followed by the 2-minute Q&A. So for both the presenters as well as for the judges, I'm going to be equally strict. We're going to be 3 minutes, 2 minutes. So I want to take a moment to say thank you to all the organizations that have helped make this a reality. We had an amazing group of collaborators. I know Miguel from the top of my head is a representative from RIMAC who was a key enabler of this event, essentially spreading in Peru, where we ended up having an amazing representation from Peru in this event. So thank you so much, Miguel. We'll hear from him in just a second as he's a judge. And we have many others that are not necessarily represented here, but have also helped either as judges or as mentors. And I want to thank you. So with that, let me quickly allow our judges for today to introduce themselves. Diana, let's start with you. You should be able to unmute yourself.
Yeah, great. Do you hear me?
Yes.
Excellent. I'm Diana Popa. I'm founder and CEO of Extensio, a B Corp based in Mexico. We work with ICTs in order to give access to critical information to smallholder farmers. We have impacted today up to 19,000 farmers in Latin America and over 330,000 lives in our continent. And it's an honor to be here. I'm also a mentor, and I love being a mentor for startups and students. And an honor to be here, and congratulations to you all for being here today.
Thank you, Diana. Carlos.
I am Carlos Garcia. I have spent many years in the healthcare industry, mostly in emerging markets. I have run Latin America, Asia, Africa, Middle East. Virtually every single emerging market on the world at some point has been a part of my responsibility. After I retired from Novartis, I went to run a small startup here in the US of early breast cancer detection. It's a small device company. I sit in a few boards, mostly on startups, because that's where my passion is. And I am a dual citizen of Colombia and US, but have lived in over 10 different countries professionally. And my kids were born in Manila, the other was born in Buenos Aires, so been packing and unpacking my bags for many years. But now I'm settled.
That's awesome. Carlos, thank you so much for being here. So Diana, did I miss, where are you from? Where are you coming from?
Oh, I'm French-Romanian. I'm born in Romania. I lived in France and Romania before moving to Mexico. And
Nice.
as Carlos, I've worked in a lot of countries in this world, and I had the chance to.
And I always love to ask.
I'm a citizen of the world. It's hard to me to say where I'm from.
I know, it's a long answer. Where are you today? Are you in Mexico?
I'm in Guadalajara, Mexico.
Very cool. Very cool.
And this is home now.
Very cool. And Carlos, what about you?
I am now in Key Biscayne. You could see the beach from the.
No, don't do that to people here.
Right,
No,
right.
including me. I don't wanna. Okay, that's fine. Now I'm jealous. Carlos, thank you so much for being here. Miguel. You should be able to unmute yourself.
Shoot, sorry about that.
Got it.
Everyone, it's a pleasure to meet you and be here with you. I'm excited you guys chose this track, which is extremely important to try to tackle COVID. I am based in Peru. I'm both a Peruvian and a US citizen, but was born and raised here. And then I went up for grad studies in the States. I work for an insurance company and also a healthcare provider company. So COVID is very tangible for us. We're trying to figure out how to help people and especially how to detect cases and detect and monitor the spread. So we're really looking forward to learning from all the great ideas you guys are bringing.
Awesome. Thank you so much, Miguel, for being here today on Father's Day, by the way. Happy Father's Day. Feliz Día del Padre. Y Carlos, Feliz Día del Padre también. No sé si if you celebrated in Colombia the same day as today. It's not in the Dominican Republic, but I know it's in many, many other places. So happy Father's Day. Let's get started now. First, I want to go through a few items for people to kind of like set the stage really quickly and explain how we're going to be working today. So first of all, this is what we've done over the weekend. Everything started with the pitch on Friday. You formed teams, you started hacking solutions, you got feedback from mentors, you iterated on that, and now we're going to be presenting it. I'm extremely excited to see those presentations. The judging criteria. By now, you know this judging criteria pretty well, but I wanna repeat it for just a second so that everyone understands what the judges are going to be anchoring on. They're going to be anchoring on the impact that the solution or this potential solution has or could have in the market as it relates to the COVID-19, specifically as it relates to this track. The innovation of it. What is the innovation in your general solution? How are you going to implement this solution? And how do you deliver the message? This is a really key thing. As David Beckett was saying yesterday, ideas need a voice. And the voice that you present here would also be evaluated. So logistics of the final presentations, really quickly. Again, presentations will be recorded. This entire session is being recorded. Multiple team members can present and answer Q&A, but we recommend that one individual presents. And if you need multiple to answer in Q&A, you can do that. We'll have 3 minutes of presentations followed by 2 minutes of Q&A. Again, I will be strict with the 3 and the 2 for both parties because we need to move quickly. We don't have a lot of time. The order of the presentations are random. You'll see that you'll be notified 5 minutes before your turn. So in these slides, we'll have divider slides that will notify who is next and who is coming after that team. So you have 5 minutes to prepare. The way we're gonna work, like allow for you to present is by you raising your hand. I'm gonna be flipping slides on your behalf. And I'll ask for you to please tell me when to flip slides. And if you say next slide, or that would be ideal. I think that's what works best for me personally. Please raise your hand on the hand functionality. I'm gonna show screenshots on how to do that through Zoom, but once you raise your hand, you're the presenter, Enrique or myself are gonna unmute you and you're gonna be able to start presenting. So I could give you the 1 minute warning. I am happy to do that. And what I usually do is that on my camera, I show my phone and I show how much time you have left. If that's not working or if that doesn't work for a team, please let me know and we can try another method. And this track will have 3 winners out of all the presenters. Okay, so to get started, again, for the raising your hand, in your screen, you should see a participants button that right now should have 124 people. You click that and there should be a raise hand button in that once you click on that participant list. The host will will unmute on your behalf and then you'll have 3 minutes to present. Okay, let's get started. First team coming up, it's team A025. For the judges, I want to make sure that you guys have a moment to open up your judging form, select your name, and then select this team. And you should see it in the order of the presenters. So they should come up in the same order that we're going to be presenting them. If you have any questions, by the way, judges, please let me know or let Enrique know. One thing that I want to highlight before we get started, we only have 3 winners for this track, but every project in this track can and should continue post this weekend. So the feedback that you can give individuals or teams through the form would be really, really much appreciated. We've seen from previous events that what teams really see, like what they see most value on, whether they win or not, is the feedback they get from experts like yourself. So please take your time to also add feedback on those sections that have that you have available on the form. Okay, team 025, Tracers 19. If you raise your hand, great. So we have Carlos and Galo.
Hello, just a question. My team was 005 and it appeared on the screen, but this is not my slides.
Oh,
It's mine. It's Galo Castillo for this presentation.
okay. So there was a mistake
Yeah.
in the numbering, but sounds good.
Okay, perfect. So
Carlos.
I guess I'm going to wait, right?
You will wait. Make sure you ping Enrique so that we can triage on the back end and make sure we have your slides in. Okay?
Okay, perfect.
Sounds good. Galo, we'll do the 3 minutes.
Okay, so when the latest technology takes time to reach the most vulnerable, how can we use this available one to save them? My name is Galo Castillo, and I'm going to tell you how. Next. This is how a device that works with 2G technology looks like. Next. The 35% of Latin American mobile users do not own a smartphone. Actually, the 17% still use 2G technology that does not allow them to download mobile apps. Moreover, COVID tests in some Latin American countries cost around the 20% of the basic salary of a citizen. Next. So there are several challenges, such as there are no COVID tests for everyone, not everyone can afford tests, and app solutions do not include people without a smartphone. Next. How can we obtain data to identify infected people? Next. Our solution consists on a USSD message system plus data analytics. Next. USSD messages are not exactly SMS, but work like interactive SMS. They allow mobile phone users to communicate through a menu with fixed options of answers, and they work with 2G networks technology. Next. Our solution basically consists first on a partnership between governments or any other institution with telecommunications company to send surveys to the citizen through USSD messages to let them tell about their situation with some questions. Then that data can be used to show visualizations such as heat maps and other information that could be useful for governments or any other institution to locate neighborhoods with people having a lot of COVID symptoms and effectively allocate resources. Next. This is basically how a survey would look like. It wouldn't be more than 7 questions. Next. Through these surveys, we collect data about suspected symptoms and information to identify risk groups. Next. The customers of our solutions are governments, research institutions, ONGs, and our users are mobile phones owners. Next. Citizens are not going to our solution. Our solution is going to citizens. Our solution is scalable, quick to deploy, and can be massively used. Do not reinvent the wheel. Innovate on how you use it. Next. Thank you so much.
That's awesome. I apologize that I didn't give you the 1 minute, but you did perfect on timing. Now we're gonna do 2 minutes of Q&A.
Any idea of setting this up?
Sorry, what? Can you repeat the question, please?
Any idea of the cost of the setup, the infrastructure, putting at the back end and all of that?
Well, every message can cost less than 1 cent of dollar. Actually, we talked with telecommunications, well, with the chief data officer of a telecommunications company in Ecuador, and he told us that it could it could be very cheap, and it could cost like just fractions of 1 cent of dollar. Also, the infrastructure for the dashboard design and the communications of the data, the transmission of the data, shouldn't be no more than annually, I think no more than $10,000. It could be very cheap because it does not communicate with a lot of entities, or it do not have like a massive amount of users.
I have a question too. Do you hear me? Yes, perfect. How many people do you plan to impact in how much time, and how do you make sure they answer to your surveys?
Okay, we have thought on using some incentive like during at the beginning of the survey of this use USSD messages, tell them that at the end of the survey they could know maybe the risk of giving them some recommendations about using their data, giving them some recommendations of not getting COVID, and also offering maybe some coupons of like $5 or $10 to get food, for example, or medicine, depending on their situation.
Galo, thank you so much for that answer. Thank you, Carlos and Diana. Thank you for the questions. We're now going to continue with our next team.
Thank you.
Great presentation. Next team is A005, Community. Please.
Alfonso, actually, there was no mistake because the coming up is the one who is coming 5 minutes later.
Yes.
Gotcha. Carlos, you got worried, but we gotcha. We gotcha.
Perfect. Thank you so much,
We're gonna give you the
guys.
3 minutes. Let's go.
Okay, you let me know. So let me tell you a really special story. This is Mary. Mary is the head of her family. She's a working Latina woman supporting both her parents and 4 children. But that's not what makes her story special. Next slide, please. She was admitted at the hospital for COVID-19. Next slide, please. She is one of the 4 million people that have recovered worldwide. Next slide, please. Another one. There. She is immune, and she is now fully integrated back into society, economically active and able to continue supporting her loved ones in a paralyzed country in full lockdown. How did this happen? Next slide, please. Community happened. Next slide. Community is a solution, and more importantly, it's a protocol. It helps to assess immunity in COVID-19 recovered patients. Next slide, please. It connects patients, healthcare providers, and health institutions, and this is how it helped Mary. Next slide, please. Upon hospital discharge, her doctor informed her about the community protocol and asked for her informed consent to register her in the protocol. Next slide, please. She approved and got an appointment at the closest available tertiary care hospital. Next slide. There she got 3 tests. She got the standardized viral load detection by RT-PCR, the standardized immunoglobulin detection test, and we proposed a novel flow cytometry assay to detect lymphocyte subsets that have been reported to grant immunity to COVID-19. Next slide, please. Later on that week, she got her results. What do they mean? She has a quantifiable immunity. Therefore, she can safely return to her new normality. She can provide to her family and be safely reintroduced into society without any social stigma and without endangering anyone. How can we make this possible? Next slide, please. The community protocol relies on an app which is actionable, accessible, secure, convenient, and friendly interface meant for patients and healthcare professionals. It's been planned to work on the cloud for greater accessibility and is primed to safeguard the data from our patients because it's HIPAA compliance oriented. Actually, we went forward and have a working demo. We'll show you the link later on. This is easily implementable relying on doctors, cooperation, Facebook advertising, and live campaigns at hospitals for recruiting patients. Besides, as working in the cloud, it's 100% scalable and customizable. In other words, we're relying on existing infrastructure, existing technology, existing tests. We're only repurposing them in an innovative way as a unified immunity assessment protocol. We are a multidisciplinary team with medical, engineering, programming, design, and even mathematical backgrounds. We came together with one goal, to generate a positive change against this crisis. This is a novel, feasible solution, and with your support, we know it can and will work for Latin America. Get into action, help us generate this change, and this is the way forward. Thank you.
That's literally 1 second on the clock. That is fantastic presentation. Love the slides, which I didn't get a chance to see before. Let's give 2 minutes for the judges to ask questions.
Perfect.
Carlos, great presentation.
Thank you.
What are the main barriers you guys anticipate to deploying this and having it get to scale that actually can make it work?
Well, the main barrier, and actually part of our whole application, is we need the support and cooperation of health institutions. I mean, on all levels. We're talking about doctors' cooperation, nurses' cooperation, and social worker cooperation, and even directors and like administrative cooperation to implement this system in the discharge of patients. We also have a way of not only registering discharging patients, but also past patients that in the past months have been discharged from healthcare.
Carlos, how is your solution different from the immunity passports that are given here and there to some patients?
Yes, well, that's actually an awesome question. And we are different in the way that most of these immunity passports and all of these tests that are being done rely on immunoglobulins and viral load tests. And these alone have been proven to not be as reliable as we would like, because we don't have any way to measure how active or how effective these immunoglobulins are. And we are talking about that they may work, according to recent investigations, for top 4 months. And that's just like the maximum limit. And with these lymphocytes that we propose through flow cytometry, if these lymphocytes exist due to the maturation process of normal lymphocytes, these effector lymphocytes have to be gaining some kind of memory. They must have passed through memory. So this would prove to be a more reliable solution for actually measuring a quantifiable and effective immunity.
And with that, that is the 2 minutes of Q&A. Thanks so much.
Perfect.
Carlos, team, judges, awesome presentation. Now
Thank you,
the
guys.
next team coming up is team A009, Positive App Tracer. I believe they had an updated name. So for the judges, you may see an updated name. But for that, could the presenter for Plus App Test Trace help raise your hand? Claudia, okay. I'm gonna ask you to mute.
Hi,
Okay.
how are you?
Good, how are you? Great, we'll give you 3 minutes.
Okay. Well, today the app is called the Positive App, and the algorithm is test, trace, help, and repeat. Help us to help others to fight COVID-19. Next, please. This is very simple. We have a Paris problem is very, very high. We are not doing mass testing. We are 30 million of people, and we are just have 1 million tests. We are not doing contact tracing. We are just contact the family members, and we already have a collapsed health system. When we have 1,000 UCI beds, and we are just occupying right now 8 and 1,500 beds. So we are very collapsed. And we have solutions that are fast, and we don't have cost for that. We can use it. We have health personnel that are under leave because they are under above 60 years, and they can act as contact tracers. We have volunteers for Bicentenario, and they can provide help to people that is going to be in quarantine or they are going to be tested as positive. We have the army that is well equipped and trained for emergency situations, and we have the institution called COEN, and we have community health workers that can give mental health support to people that is just be positive. They are going to be positive. Please, next. So the app, the positive app, because it's referring to positive people that already know that is positive, that are positive for COVID-19. The algorithm is test, trace, help, and repeat. They only have to download the app or just a link for a web page. Download the app, fill the questions, an algorithm and epidemiological questions to know that they have really contacts that they are going to be in risk. They have to enter the cell phone localization. They have to register the possible contacts, telephone, and addresses that could be the possible contagion contacts. A link will be sent to these people, to those people, to know that the MINSA, they are going to contact them and check for their health. The health personnel that will call them and will evaluate that to be sure that they should have to be tested or just have quarantine. That is filter one that we call. MINSA will get information from that and take tests in possible positive contacts. So the health will be provided by the Army and the volunteers using information from filter one and filter two. The positive contacts will repeat the cycle. That's it. Next, please. We believe in this project because it's simple, free, and only need we all. That is the only thing that we need. Yes, thanks. That is
Thank you so much, Claudia. We're gonna do now 2 minutes of questions. Carlos, you're muted. There you go.
Claudia,
hi.
This is very labor intensive because you require the help of many different entities. And any idea how can you escalate this to be more democratic without having so many people involved, because many things can go wrong with so many players?
Yeah, I know. We were working. I'm working in a group in Peru that is just we are developing this kind of instruments, and we know how to do the escalate. The only thing that we need is politic volunteer, and we can just start in Arequipa because we just need a link or just develop the app. We have developers. We can just develop the app, and we need to a free server. We don't need a server, and we just can work with Lambda functions, and we only have to give to MINSA API links to work with this solution. They only need to try to concentrate their efforts in connect the people. The volunteers are, right now we have 5,000 volunteers, and we need to integrate them, so.
We have 30 seconds for one quick question, if there is. If not, we'll continue our next team.
I was wondering, you say that the project is free. I was wondering why you say it's free. Is it free for the user, or do you see
when
it as a lot of volunteers?
The free is because when you give a link for community with a very high communication campaign, community is going to use it, and they only need like one soul to enter to a cabin, an internet cabin, and just take a moment to enter the names and enter the information that we need, which is very easy.
Thank you, Claudia, for that. With that, we're gonna have to continue our next presentation, but great presentation. Let's go back on mute. We'll lower your hand, and please, the presenter for biomasks, please raise your hand on the Zoom link, on the Zoom room. Coming up after biomask, note that we have saliva spot. I think I know this presenter. I'm gonna, Leopoldo, where are you? Let's ask you to mute.
Okay, I'm here.
Perfect, 3 minutes.
Ready? Hello everyone, my name is Leopoldo Naranjo. I am a Venezuelan researcher working as a professor at Iquian University in Ecuador. The proposal I am presenting today is biomask for tracking, trapping, and detecting SARS-CoV-2. Next. COVID-19 pandemic is like climate change. It's a very big global problem because of the high transmissibility and lethality of the virus. Today, almost 9 million people have been confirmed as carriers, and 500,000 have been died by this disease. Only in the United States, there are 120,000 deaths, and this number are increasing. Next. In spite that the best strategy to fight COVID-19 is to identify cases and isolate them, there is a strong evidence suggesting that people without symptoms can't spread the virus, and the detection rate of asymptomatic people is very low or null. However, we found a common point between asymptomatic and symptomatic people, and is that all of them must use a face mask. Next. For that reason, our goal is to develop an innovative strategy to increase the detection rate in asymptomatic people by using synthetic biology. In comparison with other current solutions, our biomass targets directly the silent SARS-CoV-2 carriers. Next, please. Our proposal have two phases. The first is for tricking and trapping the virus using the replaceable bio-based smart cartridge located inside the mask. The user can check regularly to see if their breath contains virus. The mask has a long life and only the cartridge will be replaced. The second phase is for the viral RNA detection using CRISPR-Cas13 technology. This assay will be performed privately by the user. Is science at home in the pandemic era is beginning. Next, please. As you can see, our proposal is intelligent and sustainable because it's eco-friendly and use innovative biotechnologies. Is cost effective because it needs a small amount of material and reagent, and is cheaper than expensive RT-PCR test, and is highly efficient because apply CRISPR-Cas technology that have attomolar sensitivity. Next, our team is formed by young and proactive molecular biologists from Peru, Aixa, Colombia, Alexander, and United States, Chaitali, and my person, also John in spirit from Ecuador and Venezuela.
Leopoldo, thank you so much
for your attention.
Perfect, perfect. 3 minutes, 2 minutes now for Q&A.
So congratulations, this is a great idea as all the others. What are the expected precision and sensitivity and in general propensities for error of this mechanism on a mask with it being manipulated, etc.?
Okay, the sensitivity of the technology is very high because it's at attomolar levels. We need only 10 RNA of the virus in 1 microliter, okay, of solution, okay? The mask is the same. The mask have live for utilization. Only the cartridge is removable, okay? The user can remove this cartridge frequently, and it's very good because it's very cheap because the user don't need to buy another mask. Okay, you can buy the mask with 6 or 10 cartridge, smart cartridge.
Any thoughts about the ease of manufacturing those cartridges or whatever additive you are adding to the mask? How is that to produce it? Any thoughts on that?
Yes, yes, it's very easy because this technology is very similar to the quit kits for SARS-CoV-2 detection, okay? Developed by others laboratory like Broad MIT or in Berkeley University. It's possible to match this proposal to the great transnational that manufacture a lot of masks.
Hi, Leopoldo. Thank you so much for those answers. We now got to continue to the next team, but great presentation, Leopoldo. I saw at the beginning, I saw it today, I see it today. I'm really proud to where you've taken it with the team. We're gonna go mute now. Great. Okay, and we're gonna continue to the next team. Saliva spot. David, great. Oh, was that David? Who's for the presenter for Saliva spot, please raise your hand through the Zoom room. David, there we go, that's what I thought. Oh. Give me 1 second, let me mute you first.
Hello.
Here you go. Now we can hear you.
Okay, awesome. Saliva spot, non-invasive, low cost, user-friendly. Next. Latin America has become the epicenter for COVID-19 worldwide, with almost 2 million confirmed cases and no signs of slowing down. This disease has had major consequences for the world economy, as it is believed that many nations will fall into a recession. But how can we identify the immune if we are only performing 14,000 tests per every million people? Next. Current SARS-CoV-2 antibody tests require a blood sample. This material is then sent to a highly equipped lab for screening, which is a slow and expensive process. We need accurate and rapid immunity diagnostic tests in order to manage the outbreak and jumpstart economies. Next. To solve this, we introduce to you Saliva Spot, a rapid testing strategy. This is a paper-based test done outside of a hospital or lab setting to detect coronavirus antibodies IgA, IgM, IgG, and saliva. Saliva Spot is beneficial because collection is easy to perform, safe, and non-invasive. It has an average cost of 15 USD, and it can be done anywhere by anyone. This could monitor disease progression and help to define previous exposure to SARS-CoV-2 and provide geographical data to aid nations in revitalizing their economies. Next. We are targeting users in Latin America who would like or need to know if they currently have or were exposed to the virus. It will also be used in people in high-risk areas, thus identifying asymptomatic and pre-symptomatic people. Next. So how does the Saliva Spot device work? Well, first, users will spit into the funnel of the device until an indicator turns green. Next, they will push a button to filter the saliva of food particles. The filtered solution will move through a flow strip and provide a positive or negative readout depending on the presence of antibodies, similar to the process of a pregnancy test. Next. On the back of the device, there is a QR code. Once the user scans it, they will be directed to a website which supports multiple languages where they can press a button indicating their test result. Unlike contact tracing apps which use GPS location, this web page records the IP address of the user into a database so that governments can be informed of potential COVID-19 hotspots and users can feel safe that their privacy won't be compromised. Additionally, we will include a 1-800 number for users to call and inform their results. We have connections with a saliva testing company and Albert Einstein Israeli Hospital in Brazil, so we can turn our prototype into an actual product. Next. Our team is composed of leaders in diverse fields: salivary research, microfluidics, chemical engineering, electronics, business, and bioengineering. Next. So who is ready to spit on it? Thank you.
That was awesome timing, literally 3 minutes. Great, 2 minutes now for Q&A.
Great presentation. A quick question: How are you foreseeing your costs to evolve as you gain scale? So we are talking now about $15 per test. As you gain scale, how are you foreseeing this cost to evolve? And I don't know if you have any figures.
Alfonso, we should unraise Deborah's hand, I believe.
Deborah, you can speak. You're unmuted now.
No, sorry, it was for David. It was a mistake.
David was unmuted. What happened? Ask to mute. Here you go.
Sorry. I'm gonna ask Michelle, who is on our team, to answer this question.
We were all trying to raise hands, so we were already here, but we don't know how to do that.
Hi guys. Yes. In order to answer your question, in terms of economies of scale, we are looking that the more we produce, the more production we have in different countries, the lower the cost could potentially be, or we could stay at that same price.
So
$15 for Latin America could be on the high side. So you will be urged, I would think, to look for ways to significantly reduce the unit cost of this 3D printing of the cartridge or something like that, that will really lower that, because that's 3 days worth of a meal for many families. So it's easier said than done.
Absolutely.
So those are the 2 minutes that we have for Q&A. Apologies that we had issues unmuting folks. The presenter for future presentations, please don't unmute yourself until we unmute you, and you can direct us to who else to unmute for the Q&A. Now, moving on to the next presentation, Nanoucoco. So we have, let's lower the hand of Deborah. We have several hands up here. We'll unmute Luis first. Great.
What if I told you one of the smallest particles that exist could solve one of the world's biggest current problems? What if I told you this solution could help the world return to normalcy by identifying all COVID cases so that even those who are asymptomatic would be identified? So what could bring our lives back to normal? Hi, my name is Louise Lima. My team and I believe the answer is nanoparticles, provided to you by Nanoucoco Colloid. Currently, businesses are attempting to use temperature measurement tests to identify potentially infected people, but they are unable to identify those who are asymptomatic or immune. A lack of trust in the government throughout much of Latin America has also led millions to deem any government-sponsored tracking as unreliable. Next, please. To solve this, we are presenting Nanoucoco Colloid, an aerosol solution that contains 2 types of non-toxic biocompatible nanoparticles. The first type would provide a signal in the presence of the virus. This nanoparticle would identify the virus itself so that it would work for even for those who are asymptomatic. The second nanoparticle would kill any identified viruses to prevent its spread and sterilize surfaces. Next, please. This solution could be administered by businesses so cost doesn't fall on the individual and trust does not rely on the government. Businesses would spray this aerosol on some surface at their door as a quick test to identify the individuals carrying the virus before they enter the building. If a person is carrying the virus, the aerosol would give a signal so that they are not allowed in to infect others. Next, please. The market audience will be focused on bigger businesses that typically have large gatherings because they can rapidly test many people to prevent large-scale COVID contagions. Hospitals, grocery stores, restaurants, schools, these could all go back to full functionality with no fear of infection because any COVID is stopped right at the door. This is the solution to bring the economy back to its feet. Next, please. Even better, this solution doesn't stop with COVID-19. Once fully developed, these nanoparticles can be easily adapted so that the same technology can be used to detect, prevent, and kill even more lethal viruses in the future. Next, please. This is our team, with the qualified and skilled members ready to achieve this challenge. Next. We believe the applications of Nanoucoco Colloid and the opportunities it creates to save lives in Latin America and beyond are endless, and we can't wait to get started. Next. We're ready to start working. Are you? Thank you.
Thank you so much, Luis, and thank you for the team. Awesome presentation. Now, 2 minutes.
Hi, Luis. Thanks so much for the presentation. Sounds like an awesome idea. How far away, how much evidence is there of nanoparticles working as a sensor to detect COVID in particular, and to fight it, to basically fight it, kill it off?
Can I call in Andrea to answer this question? He's our nanoparticle expert.
Hi. So, first question: how can we detect the virus? So it's easy. All the coronavirus actually has some spike proteins on the surface. So I am actually working with some professor of virology in my college, and we identify a marker that we're going to put on the surface of the nanoparticles, so the particles can attach to the virus and kill it. So it will attach, identify it, and attach the virus. To kill the virus, we are actually using photocatalytic nanoparticles. So when they attach to the virus, they will use the natural light to catalyze a reaction that will actually destroy the nuclei of the virus.
So Andre, sorry, just to follow up on the question, have you guys done this? Is there evidence of this, or is this work in progress and still to be shown to work?
This has not been done specifically for virus, but we have been researched, and this already been done for cancer cells and bacteria that actually use silver nanoparticles to fight bacteria, and some type of polymeric nanoparticles to fight cancer cells. So the concept itself, it works. We just need to adapt and change a bit the method of production to accommodate our nanoparticles.
Do you have any cost targets?
Yeah, I mean, the only cost we are now considering is the materials, because right now I have a lab in my university that the professors and the college itself allow me to use for free, to equipment and measurement equipment, everything I need. So the only thing we need right now is to buy the chemicals, but we are trying to make nanoparticles from cellulose, which is a natural polymer, very cheap.
I want to thank you for the presentation, for your detailed answers, but now we need to move on to our next theme. Awesome presentation again.
Thank you.
So let's go back on mute. I'll lower your hands. Pablo, Andre. As I'm giving some times for judges to give us some feedback. Also for judges, feel free to, so we should have 1 or 2 judges ask questions per team, since we only have 2 minutes. And if you're not asking a question, please use that time to give the teams extensive feedback. So moving on to our next team is T3. Coming up, spiderweb. T3. Patrick, let's unmute you. Okay.
Testing, tracing, tactics. None are effective alone, but together they can revolutionize regional response to the pandemic. The T3 platform aims to do just that. The solution to COVID-19 lives here. Next, please. First, the problems. One of the largest problems facing Latin America is using effective testing and tracing strategies. Expansive testing and tracing is infeasible due to limited economic resources. Besides, local data analysis is essential for halting the spread of the virus and is not currently being leveraged. This is where our platform excels. Next, please. Local testing and tracing data can be used to inform an ever-changing dynamic model. In return, recommendations for the most efficient policies become available, including the strategies to test and trace different members of a population. This new data is reincorporated into the model to obtain feedback for policies. Next, please. Testing stratification is the driving force behind an efficient use of resources. Various combinations of tests based on population risk and exposure is the most effective strategy. We simulated an up to 40% boost in detecting asymptomatic and COVID-19 immune patients, and a 13 times reduction in test kits required via the T3 algorithm. This results in a 96% reduction in testing costs. Next, please. Tracing entire populations is inefficient and faulty. Identifying people who have most likely spread the virus using a method similar to the Google search algorithm reduces the number of people needed to be traced. T3 tracing, used in conjunction with the T3 stratified testing algorithm, boosts accuracy by 32.1%. Next, please. Our model is based on differential equations and dynamic factors, such as incubation period and local policies. Unlike AI and other epidemiological models, which don't account for local policies, T3 can incorporate all factors and provide recommended solutions. Next, please. Our advantage lies in our ability to address present problems. Our demo has identified current policy initiatives that Monterrey, Mexico can undertake to stem rampant cases. Recommendations would have led to fewer asymptomatic patients and deaths by 10% and 15% fewer critical cases. Next, please. Our team's extensive and diverse knowledge of biological methods and data-driven analytics is the groundwork which will enable us to deliver the platform. Starting at business to business, we plan to grow to larger communities such as cities and countries. Next, please. T3 incorporates current local data to drive policy development and implementation. Latin America's battle with COVID-19 is happening right now. And T3's model allows for solutions to be deployed not in months or years, but in days. Thank you very much. Thank you, Alfonso.
Can you elaborate? I get very clear on what is that you're trying to do, what is the dimension of the problem. The how are you going to do it is less evident. Can you spend just in 10 words or less, if you might, tell us how it is going to be deployed?
Sure. We have the back end, the front end development, which should be pretty easy. And we want to start with a business to business model as a proof of concept, and then approach local communities and work our way up. This is something that implements local policy, and it's easily adaptable to any environment.
Can you develop on your B2B model? How are you going to distribute your solution? Who are your B2B clients?
Sure. Honestly, this is adaptable anywhere. We would like to start with any company which will take us. We already have the case study on a city. We can easily do anything as long as we have the given data. So it really doesn't matter which company we choose. We can easily produce case studies for a city, a business, show that it is very accurate as we have, and implement it that way.
Alfonso, do you have time for a 10-second question or a 5-second question? Great. So great job, guys. What are the data quality and quantity assumptions of the system?
It varies. Monterrey, we actually had limited data and it was still accurate. We tested it in that period from May to June. We can easily implement all sorts of information such as ventilators, hospital beds available. Like I said, it really is really adaptable. We have the back end developed in that way.
Patrick, awesome presentation. Awesome job to the team. Now we're going to continue our next teams. But thank you, judges, for your insightful questions. Spiderweb, please raise your hand. Okay, so we have Catherine. So we'll first mute Patrick and lower his hand. Oh, you lowered your hand. Perfect. Catherine, you should be able to speak now.
Yeah, there it is. For me, if I raise my hand, so you can click and that's it?
Yes, let's do that.
Okay.
I'll pay attention.
In Latin America, we have one problem in this pandemic. We either die from hunger or from the virus. We need to go out and work because most of our countries are known for our workforce, products, or informal workers. And we're getting tested only if we show symptoms, having the silent risk of asymptomatic cases. The solutions that are being created are apps or gadgets that track live our movements and let us know if someone we have interacted with is infected, so we can reach help. This solution is started to
Catherine, your audio is coming across really.
We give people the tools to prevent and give company.
Also, since we cannot hear, will be best if they come later and some other member present that has a better connection, and we kind of jump that later on the queue.
Yeah, let's make sure that that's understood by the team member here, though. Catherine, can you hear us? Okay, so we're gonna continue our next team. We're gonna come back to this team later at the end of the presentation. HRP tracker. Please raise your hand. Okay, Lara. You should be able to unmute.
Great, do you hear me?
Yes.
Great, so locate, identify, and track. Powerful words to save thousands of lives. Next. How can we achieve that? By locating the asymptomatic and presymptomatic. Locating patients with those characteristics may seem impossible, but not for us. High-risk groups are more prone to be infected. Plus, the recovery treatment is demanding and expensive for Latin America. Therefore, we have shifted our focus point to those inside that group, narrowing down the search, allowing us to find those who need assistance. Next. As this graph shows, 1.7 million people worldwide have a condition that could increase their risk of severe COVID-19 infection. If we zoom into Latin America, we can see that 21% of the population is at risk. Next. We have developed an online portal that will allow primary care centers to become a radar for COVID-19 and known patients that belong to the high-risk group, allowing healthcare workers to receive online training, telehealth access, request primary healthcare supplies, and how to trace and identify patients. Next. Currently, hospitals are crowded, and patients within the high-risk group still need to attend their regular medical checkups, opting to attend primary healthcare centers. Hear this out. Ex-patient suffers from hypertension, so he needs medical follow-up. Not knowing he's asymptomatic, he goes to his primary healthcare center like he normally does. The first thing the healthcare worker does is to ask if he has any symptoms by the list provided in HRP tracker. Being asymptomatic, he denies feeling any symptoms, but because of being within the high-risk group, the HRP tracker will recommend having a rapid diagnostic test coming out positive. Our healthcare worker will be ready to follow the procedure as they will never lack equipment, allowing them to identify asymptomatic patients. Next. As Northeast Brazil is highly affected, showing almost 400,000 cases and 16,000 total deaths, our project would be ideal as cases are increasing and HRP tracker would allow this idea to gradually recover. It is a useful portal that would fit in any rural area in need. Next. The Brazilian healthcare system supports these methods. We would just need software engineers, access to real-time data, PPE, and rapid diagnostic kits, data encryption, among others. Next. This would be an example of our prototype. Next. Our objective is feasible. Together with the sponsors' help, we would lower the burden of the healthcare specialists, reducing the growth of COVID-19 and saving thousands of lives. Next. Our team member is multidisciplinary and we come from all over Latin America. We are very grateful for having been part of this event. Thank you very much.
Great timing. That was right at 3 minutes, 2 minutes of Q&A.
Hi, great presentation. How do you guys see, what are the incentives and why would people join this? How are you guys going to frame the benefits to them?
Yeah, so basically, if we implement this device, people will come to us, not us to them, because with this prototype, we would be helping the healthcare system and they would implement whenever these high-risk groups need to go to attend themselves, for example, as we said, hypertensive patients. Within their constant medical checkups, they are going to go there. So we know that these people within the high-risk group are more prone to be infected, hence contagious to others, and more probably to be asymptomatic or asymptomatic. So with our prototype, what we would be doing is providing the healthcare system a tool to be dealing with them.
Very good. This is an excellent idea. Lara, are you in high school? You're a high school student.
Yeah, I'm 16 years old.
Wow, congratulations.
Thank you.
I think that you probably need to also think about a little bit more of a differentiation versus other portals. Any thoughts about that?
I don't know if Jesus would want to take over this.
Jesus, you should be able to speak now.
Okay, hi. Yes, basically, we are aiming to work directly to primary healthcare centers. I know that there are a lot of portals for online training for healthcare people, but we are aiming to those because this is the first line to cover current needs on COVID. And this goes beyond future because
we now need to wrap up. Those are the 2 minutes of Q&A. Thank you so much for the presentation. I really enjoyed it as well. Let's now mute you guys and lower your hands. And we next have team 039, Cov AI. If you could please raise your hand, the presenter for Cov AI. Great, Varun. Should be able to speak now. Hi, Varun. Are you able to speak now?
Yes. Yes.
Great.
Yes.
Let's start.
CT and X-ray of potential patients in 2-3 days of their exposure to infection. Our proposed solution, COVI system, is aimed to screen patients for COVID-19 on basis of their CT scan and X-ray reports using artificial intelligence. This will be case the burden from overwhelmed testing facilities and will be impatient complement to RT-PCR tests. How the system works. The CT and X-ray of the patients is fed to pre-trained COVI system. The system further uses the R algorithm to segregate the reports into 4 classes: COVID-19 positive, COVID-19 negative, pneumonia, and healthy. Further, our system also uses UNet neural network to identify the infected region in the lungs to critically examine the lungs. We have tested the system on 86 real-life X-ray images, and 84 of them were predicted is true. Results.
Varun, let me know if you want me to flip slides.
Yeah.
You gotta let me know when. Okay, sorry about that.
Can you move another slide? Okay. As you can see, if the patient is
Looks like Varun lost connectivity. If there is another member of the team that can join within the next, within the allotted time, please raise your hand and you can complete the presentation. If not, we'll continue to the next team. Do we have another member of COVID AI on the line? Sounds good. We'll continue with the next team. So great. For Team Human, Gonzalo, let's unmute.
And there's one more member that will be doing the presentation with me, Vanessa.
Let's get you started because your time's going.
Okay, she was going to start, but okay, I can do the presentation. Okay, next slide, please. The problem that we want to address here is the lack of a new predictive method that could adapt to the changes and the peaks of the evolution of the virus. Next slide. And as you can see, without a precise model, the government, the health systems cannot adapt efficiently to the needs of specific zones and can track the hotspots for the virus. Next, please. And here's an example from Argentina. And we can see that different regions present different tendencies in growth, and we can't apply the same measures for each of them as they don't present the same behavior. Next slide, please. The idea that we are presenting is using a statistic model to predict and adapt the peak and also provide information needed. And next slide. We've gathered data sources from scientific research, open source repositories, and also official government sources from different countries. And next slide. Our approach will be understanding the relationship between the active cases and the total cases. With this, we can trace and predict when the peak will be and if we are getting closer or further from it, so different regions can adapt properly to the needs. Next, please. Well, here's just an example of extra data that can give us more accurate information of the behavior of the virus. Understanding that higher mobility is directly related to the spread of the disease help us know where to look when we are doing this analysis. Next slide. Here's just an example of how accurate it can be implemented and trace the real development with high precision. Okay, next slide. Well, who could be helped by this? Our idea is to provide this information to governments, which will implement to use localized measures in areas of rapid growth, and also for health systems to know where they should focus their resources and be prepared for a high wave of infections. We have collaborations from indigenous organizations of Colombia and some interest in researchers from Peru. And next slide, please. Our team is composed of interdisciplinary backgrounds and we'll use our different knowledge to reach this solution as soon as possible. And next slide. And I wanted to thank you and I look forward to working with you in the future. Sorry, I was a little panicked because some of the parts were Vanessa's and some mine, but
that's okay. Judges, now we have 2 minutes.
Very well, Gonzalo.
I have a question for Gonzalo.
Yeah.
I have a question, Gonzalo. How are you going to gather the data that you need for your model?
The most reliable sources have been different national sources of each country. For example, there are some web pages, and also there's pre-research that, when contrasted, can give us a more consistent view. For example, after looking at different sources for the same country, I only saw discrepancies of 1 case per day or something like that. So it's quite consistent information of the data gathered. I don't know if that answers the question.
If no more questions, we'll continue with our next team. Gonzalo, thank you so much for the presentation. You did an awesome job. Yeah.
Thanks.
Okay. So we're gonna, if you go back on mute, that'd be awesome. Fuse Shadow, next team. If you could raise your hand. I believe that's Aishnavi. Oh, sorry. Boyan, and I'm having Boyan and Vaishnavi both raise your hands. You know which one.
Hello.
You both can speak. Yep. Go ahead.
Yeah.
All right. 3
Hello.
minutes.
Should I start? Okay.
Yep.
Yeah. Should I start? Hello.
Yes, you should start.
Okay. WHO declares Latin America the new COVID epicenter. Brazil has more than 970,000 confirmed cases, the second highest in the world. Next. Our main motive is to bring an on-ground algorithm that can help the government get a specified and defined path of how to identify, trace the infected patients, keeping in mind the asymptomatic by observing immunity status. Next, please. We will consider a sample of say 60 people and select 2 people on the basis of the traveling history and attempt RT-PCR testing for identification. Next, please. There are 3 cases, and please play both the videos.
There are three cases possible. Case A, person A has antibody. Person A has antibody of this indicates the area is infected and needs to be sealed. Case B, person B has antibody and person B is negative of the virus. Some of the more tests has to be conducted for more precision. Case C, person has A has no antibody and person B is positive of the virus. In that case, we need a RT-PCR uh, uh, test in order to be sure that he doesn't contain virus. If person is positive, then more tests are need to be performed in that area, and if negative, then area is completely safe. Next, please play both the videos. We focus mainly on practical approach, and we also went through a study of around 338 infected patients, history and their IG behavior. When we talk about immunity to a virus or a disease, we talk more about immunoglobulin G, as when a body is infected, then it first has rise in its IG because IgG lasts longer. You also see IgM level right as someone has been infected. Please play both the videos. So even if person was asymptomatic and had COVID-19, if a random sampling of the population were done, that person might show that they have antibodies to COVID-19. This can be tested by normal blood test or some finger sticks, which makes it very easy to implement. Next, please. The most critical phase is silent hypoxia, asymptomatic, that keeps the patient asymptomatic for many days. Next, please. We will be using pulse oximeters. These small device placed on fingertip will show two numbers in few seconds, and they are oxygen saturation and pulse rate. The COVID pneumonia patient had oxygen as low as 50%. These are capable of telling response as asymptomatic situation. Next, please. We tried to bring on-ground algorithm rather than any app or expensive tech so that government can focus more on functionality of testing and segregation so that everything is well managed. We have a team from first year engineering background belonging from India can't deny that doing yoga and Ayurveda. Thus, they recommend consumption of ashwagandha that boosts our immunity, and government should also make it available for everyone. Thank you.
Thanks.
For Q&A, I would want you to unmute my teammates so that they can answer the questions.
Sounds good. Thank you.
Yeah.
Great presentation. Who do you guys think are the main stakeholder or stakeholders, and what are the costs to implement this at scale?
So the main thing that we focus over here is the complete audience. Like many times there are cases like those who can't afford these testings and all, they unfortunately they just give up their life, or they can't afford that. So we have tried to focus more on the complete society rather than just creating some technology or some app which would just be available to those who can use smartphones. And the implementation cost in Indian rupees is around 1 crore.
Okay. Sorry, let me take you one step back. So the problem that you're trying to solve is to come out with a more precise test.
Yes, please, sir. I couldn't understand you. Please repeat your question. I would want you to unmute Ravi for this answer, please. Alfonso, sir.
So I'm trying to understand the problem that you're trying to solve. Is the problem that you're trying to solve to have a more precise type of testing?
Actually, in the 60% Latin America, 60% users don't have mobile phone, and only 20% of the 28% who have the phone are using smartphones. So we can't completely rely on smartphones and app and technologies for stopping the communication of this disease. We need a small.
Ravi, those are the 2 minutes. We now need to continue to the next team, but great presentation, team. We'll now take you, go on mute, and have fast test. Please raise your hand. Okay, Sophia should be able to speak now.
Yeah, so next, please.
Great.
Next. Next. So currently, the lack of frequent testing and reliable tracking of the virus spread impacts the reopening of economies and the ability of government entities to have accurate information. Moreover, asymptomatic individuals that are virus super spreaders cannot be easily detected. Next. We developed a testing device that individuals can use at home that is safe and yield rapid and reliable results. By using the existing ELISA methodology, these stripes will detect the levels of IgM and IgG antibodies in the blood. The fastest device will translate these analogical results into digital signals displaying the results in the app. Currently, our principal target user is airport staff that will soon have to return to highly crowded and prone to the virus work areas. Next. But to better understand this process, let's meet Julia. She's a TSA official that works at Boston Logan Airport. The airport has provided its returning employees with the fastest kit. She will perform the test at home once every 2 weeks. After connecting the device to the app on the mobile phone, she will receive her results of IgM and IgG levels under 5 minutes. To start the screening test, she will put a blood sample on the strip, followed by the reagent. Once the pigmentation of the strip is complete, she will insert it into the device, which, under the spectrophotometric method, will send a voltage proportional to the amount of light received by the receiver circuit. The microcontroller will show the results of IgG and IgM levels, and then the Bluetooth module will send this information to the app. Next. Once the app receives this information, it will be stored through Wi-Fi in the cloud. So the government and health institutions have access to it. To make use of this application, the user creates an account with a username and password. Additionally, terms and conditions are signed to give consent for third-party access to the test results. These results can be organized in calendar on a daily, weekly, monthly, and annual basis. The app will create graph and statistical analysis and will show the safety protocol in case the results yields positive. Next. Our next steps will be to partner with government and health authorities, pharmaceutical companies, and COVID testing stripes manufacturers. Our future goals will be to quantify the quality of the results and to create a fast test that will detect other types of diseases that are recurrent in the LATAM area. Next. I know we are very ambitious. However, we are confident that with the right team and partners, we can create the first at-home COVID-19 testing kit. Next. Thank you.
Sophia, has this technology already been tested in the lab or anything? Do we really know whether this for home use is going to be effective?
Sorry, that we will.
Sophia, do you hear the question?
Yeah. Sorry, I didn't hear the last part of the question, sorry.
No, I was wondering whether this has already been tested at the lab to validate whether the technology is effective.
Well, we haven't tested. This is a beta version, so that's why we want to partner with pharmaceutical companies to test this. Actually, in the laboratories, they use the ELISA method. That is the one that are like simple, but that's done in the labs. We want to do it at home so that people can do it very frequently. They can test their levels, their blood levels very frequently. Just like it will be for people who have diabetes and like a glucometer, but with COVID-19. That's the main idea, and that they have to be recurring testing themselves, such as airport staff. And then we would like to bring this to Latin America market after testing this in the US.
What is your strategy to scale in Latin America? Have you thought about it?
We haven't thought about it, but that's why we need also to partner with pharmaceutical industry so they can help us. We thought about airports, so that's why we thought first Boston Logan Airport and then go to an airport like Ciudad de Mexico, Benito Juárez, or Guarulhos in Brazil. Yeah.
With that, we'll continue to the next team. Thank you so much, Sophia. The next team is Mayong. If we could have the presenter from Mayong, raise your hand.
Good afternoon. You can go ahead and put on the first slide for us. So, Mayong, what we're really looking to do is track down the typhoid Marys, next slide, of COVID-19. What the problem is that asymptomatic and immune individuals are elusive and highly contagious vectors of COVID-19, next slide. Really the focus that we'd like to drill into is trying to track down those COVID Marys. Thinking you're immune or asymptomatic might be great, but you're still a risk to the public health. And we're not going to find typhoid Marys or COVID Marias in the healthcare system, so we have to look at the workplace. Next slide. More Latino Americans are going back to work earlier than we had anticipated. So that's why we're really focusing on this solution. So who is Maria? Potentially an immune or asymptomatic individual who's going back to a formal work job at a corporate facility or even at a shared office. And she doesn't know that one of her colleagues' husband has tested positive. Next slide. And Maria has not and will not develop symptoms. So what is Mayon? It's using existing technology of Wi-Fi. And when I say Wi-Fi, I don't want you to think about logging onto the internet. I want you to think of Wi-Fi as a sensor and also a signal, because it can actually use like echolocation or sonar for a bat. It can map a 3D environment and figure out who's moving through that space. And Wi-Fi already penetrates 67% of the Latin American population workplace, and actually even more into the workplace. So hopping on to the next slide, we're also going to develop a novel testing strategy from the data collected from Mayon. So put 2 Wi-Fi routers in a place, figure out who's moving through that space, and then map, next slide, where those individuals actually work and actually their schedule, so you can make sure they can have the right time, the right person, the right place. And so if somebody reports that they've become infected, they can alert their teammates and their employers to do internal contact tracing. Next slide. The main focus of all of this is really to get a better job of finding potential Marias. So this Maria had a really high risk to get infected, but she's maintained a negative status or didn't even ever present the symptoms. And it's very likely that she was the super spreader of this potential outbreak in the office. Next slide. So really thinking about ¿Dónde está Maria? Is really what we're trying to get into. So the stakeholder employers who are incentivized are having people come to work, but they want to do it in a very safe way. And employees can have technology to alert them. Next slide. But really public health is really the main issue that we're looking to tackle. And with my background in clinical genetics, we're trying to reverse the positive conversion rate paradox. We're only not testing very sick people, but focusing on people that likely are not presenting with symptoms to prevent super spread. And not only just randomly testing, but strategically targeted testing. Next slide. We're really going to think about the potential of an implementation timeline and roadmap to add further redundant technologies beyond just Wi-Fi. But with Wi-Fi, you don't need to have a phone, a wearable device. You just need a Wi-Fi router that can capture its own signal that it's sending out. And further adding on further redundant testing, things like thermal sensors, and then maybe even going up to actual mobile device contact tracing. One more slide, and then further into the appendix. Since we got 4 seconds, we can just leave it right here for the Q&A. Driving public health drives economic health.
Great presentation, Carlo and team. I'm curious if you guys have looked into the difference. So there's a question of accuracy of detecting the signal and materials. Latin American materials in office spaces are different than those in the States. So I don't know if you guys have thought about this.
Yeah, depending on what sort of bar or crossbeam you're going to have inside those buildings will not penetrate across vertical floors, but horizontally, as long as you don't have fireplaces or very large bespoke funnel chutes that changes materials like a freight elevator, you would still just need to have another redundant Wi-Fi router to map around those regions. And to the signal capacity, it really doesn't have high resolution beneath 3 feet, but really you just need to measure 6 feet distances between individuals and then have a fomite tracing perspective at the end of the day. But those raise some really valid points. And yes, we have done that research on the constructural retrofits of most buildings in Latino America already. Any other questions? We have about 1 minute and 11 seconds. Thank you, Alfonso.
Do you have any idea of the cost of the solution?
Yeah, so the Wi-Fi router is already readily available. We have an estimated one that we would recommend. That's about $73 USD. What you would need to do is either have your software team in order to build software to actually map the space, or use freely available white label solutions that here in the States for a user license, it's like $11 a month. So you can do more complex retroactive contact tracing if you want to do it yourself, but there's already white label solutions. So we're not really here to present the actual software, but really to develop a strategic throughput of knowing how to test, who to test, and how to get the data to confirm, as opposed to retrospective qualitative reporting that most people do for contact tracing. And thank you.
Thank you so much, Carlo and team. That was awesome. We have only a few seconds left, but thank you for the presentation. Really enjoyed it. So next we have cool animations. Test yourself. The presenter from Test Yourself, Maria Mercedes. All right, I'll mute you in a second.
Okay. What if I told you that in the time it takes for me to present this pitch, you would know your COVID-19 test results without having to probe your nose or your mouth? This will be possible with our invention, the gummy test, which is as easy as chewing gum. So next slide. Nowadays, the main challenge is to detect people who are infected with the SARS-CoV virus. Next slide, please. Thank you. The RT-PCR gold standard is slow. It takes about 5 to 10 days of turnaround in Latin America. It's costly. It requires highly specialized lab equipment and is used normally with people with symptoms. Next. Meanwhile, asymptomatics can remain undetected and can rapidly spread the virus, as occurred, for example, in Korea and Italy. Next slide. Today, we have about 460,000 deaths worldwide and the frightening possibility of a second wave of infection. Next slide. But our easy-to-use, non-invasive, low-cost, self-diagnostic gummy test can change this situation. Next slide. This is a reliable, rapid test that can reach the whole world and can be used essentially on anyone. Next slide. This test would be perfect when immediate results are needed, as in highly visited places, and to dispel doubts regarding infections. Next slide. Our test can increase current diagnostics by about 10-fold. They will limit spread of the disease and the number of deaths worldwide and benefit the most vulnerable populations. Next one. Not to mention that ensuring safety in the workplace is key to reactivating the economy. Next slide, please. And next slide. Also, the data that should be captured could be coupled to existing apps in different locations to monitor the spread of the disease. Next slide. We know that this technology exists and is feasible. For example, chewing gum has been used for the diagnostics of various pathogens, including influenza virus. And saliva, as you will know, is also being used currently for testing COVID-19. Next slide. In this case, the virus would be trapped in a chewing gum matrix and detected using molecular tools. And our idea would be precisely to leverage molecular expertise from different academic and biotech researchers with our innovative use of this gum matrix in order to detect the virus via a color change when placed back in the wrapper. And so how are we going to implement this? We will connect, next slide, with local healthcare organizations to develop fast-track trials that are important to validate the sensitivity and specificity of this point-of-care test. We would ensure delivery using existing expert networks. And in addition, what is important is that this user-friendly, non-invasive device could be easily adapted to other diagnostic needs once the COVID pandemic is over. Next slide. We are a group of different people.
With that, Maria Mercedes, we're wrapping up the 3 minutes. We now have 2 minutes of Q&A. Thank you so much for this presentation.
Mercedes, why the gummy rather than just deposit the saliva directly into a testing type of mechanism?
Yes, that has been asked quite a bit. And what we presume would be important is that with the gum matrix, you can actually leave it in your mouth for a couple of minutes. And then that way you can actually capture more of the markers that we were interested in capturing when you do this assays, rather than just having a swab or just spit in a little thing and have a little bit of saliva. This would be like a bigger way of sampling your whole buccal cavity.
A question, Mercedes. How are you going to produce the gums?
How are we going to produce the gum? Oh, we would obviously, well, what would be the most challenging part would be what to incorporate in the gum in order to do the detection. And I guess the gums we would have to, associate with people who already do this sort of gum. Yeah.
What are the expected accuracy, sensitivity of the tests?
Yeah, it would have to be at least as good as the tests that are currently in the market. In other words, the gold standard, which is the RT-qPCR. And in terms of sensitivity, actually in terms of specificity, we would expect it to be higher because the idea would be to target the spike proteins in the virus. So it would be direct detection of the virus.
Awesome. Great presentation, team. By the way, I saw these visuals yesterday. I love the visuals today. I love the narrative overall. So great job, Maria Mercedes and team. We're now going to continue to our next team.
Minutos.
Sí.
We're gonna mute you and lower your hand. Great. So team for the Watchers, 8006. Could you please raise your hand? Elisa, very nice. Should be able to speak now.
Okay, my name is Eliseo. I'm going to present a COVID friend project. Next, please. 1 in 3 people in Latin America lack access to healthcare due to poverty level, health infrastructure, fear, and no access to healthcare system. 70%, 75% have low income, and 30% live below the poverty level. Please, next. Brazil has over 1 million cases of COVID, followed by Peru and Chile, and we know that the numbers are greater than this. Next. So how are we going to locate those symptomatic patients without having to use immunological tests and without having to leave their houses? Next. So this is COVID friend. This is the wearable monitoring device that a person is going to use in their houses. Next. So by doing this, we are detecting symptoms, assessing clinical parameters with no need for immunological measures, is low cost, and provides direct connections with the database system and the government. Next. So how to use it? By putting a device in front of your head, you're going to measure your temperature. By putting your finger, you're going to measure heart rate and oxygen saturation, and you can measure cough by IoT or a button that's going to be available in the device. Besides, in addition to it, this smart technologies will alert you as soon as the 2 or more parameters will be altered. So, and beside this, we'll send the information to a triage institution along with the government healthcare system. Next. So this is how we're going to measure it. It's going to have a detachable watch straps, long life battery, detachable pulse oximeter, and a touchscreen screen displays, and it's made of recyclable material. And let me say, the cost is going to be $10 to $20. Next. And this is a close-up how it's going to be. Next. Next. And we at COVID Friend want to empower, monitor, and alert our population with the convenience of smart tech wearable device. We hope to pivot the system post-COVID and scale up to provide remote monitoring to bridge the gap between healthcare and underserved population. Next. Thank you so much.
Thank you for your time. Now we're going to go 2 minutes of Q&A.
I don't have a question about the technology. I mean, coughing, yes, you can say yes or no. Temperature, most likely devices today will have that. But when it comes to the oxygenation, other than using the device that you put in your finger, is there any technology readily available to put into a watch-like device to test the oxygenation in your body?
Yes, of course. We have the extension. It would have an extension. There is a PO2 access in the watch that you're going to put in an extension that comes with the device, and you can place in your finger, and the device is going to read it. So it's really.
You use an existing oxygenator that connects into the device.
Yeah.
Oh, got it. All right.
Yeah, because the device has to read all 4 information that put together it and has to process it.
Sounds good. If there are no more questions, we're going to continue with our next team. Thank you so much, team, for the presentation. If the presenter for Salud en Ruedas could raise Paula. Okay, good. So first let's mute Elisa. Oh, Paula, you should be able to speak now.
Yes, can you hear me?
Yep.
Okay. So can I begin?
Yes.
Great. So hi everyone, I want you to imagine this. Maria walks 2 hours to get access to basic health services. She lives in a small town in Apurimac, Peru, at 2,900 meters above sea level. Like Maria, many residents live in the uncertainty of knowing if they have COVID-19, since the state has not yet get to them with tests. Next. So we present you, this is Maria, next. So we present you Salud en Ruedas, or Health on Wheels. Next. Rural areas are the least tested for COVID-19 in Latin America. Previous slide, please. Rural areas are the least tested for COVID-19 in Latin America. On average, only 885 tests per million are conducted in Latin America. And there isn't sufficient COVID-19 health records from rural populations that could help to further the research and treatment. Next. 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 We propose to develop mobile vehicles that can access rural areas in Latin America to do COVID-19 testing and digitize patients' health records. The vehicles will be adapted with the needed equipment such as refrigeration system, rapid COVID tests, a computer, sensors, and GPS. We will take samples and test for COVID-19 en route and take blood samples with us to take to partner labs in order to perform other analysis to enrich our data. Our target market are non-profit organizations to get initial funding, and the users of our mobile service will be rural area populations. The estimated cost is $28,000 per vehicle. Next. Part of our service with the mobile vehicles would be to generate data, important data, to which we will perform a statistical analysis for contributing to medical research. We will follow the General Data Protection Regulation. This is a demo of how our data statistical analysis would look like with different medical parameters that could help for further medical research. Next. We decided to begin the pilot in Peru because there have been quick to implement restriction measures. And first, our key partners will be non-profit organizations, local leaders in the rural areas, local authorities, PAHO and or Red Cross, ministers of health, and private organizations. Next. With our timeline, in the first phase, we will make rural areas recognition and connect with the leaders of the community. The second phase, we will develop the mobile vehicles and data system. In the third phase, we will deploy the vehicles for testing and data collection. And lastly, perform data analysis and accessibility for medical research. Next. We are a multidisciplinary team with variety of skills. Next. And lastly, let's prevent infections and mortality in rural areas by speeding up diagnosis for better decision-making. Thank you very much, and we can achieve this with your partnership.
Thank you so much, Paula. Open it up for judges.
Thank you.
Hi, Paula. Great presentation. Thank you so much. A quick question: for a country like Peru, how many vehicles would you need in order to make an important impact? And how do you define an important impact?
Yes, we were considering by beginning with a small amount of vehicles, maybe from 5 to 10 vehicles, so that we can actually trace the impact. Because if we believe that if we begin with too many vehicles, then maybe measuring impact will be harder. So starting with a small amount of vehicles will be ideal.
And to how many would you scale in order to make an impact in the country?
That would depend.
Once you have it tracked and traced and proved.
Yes, I think that would depend firstly in if we measure if there is enough impact from the first 10, for example, vehicles that we implement, and then we can escalate for maybe 20 to 30 vehicles for the country. Thanks.
Awesome, Paula. If there are no more questions from the judges, we'll continue on to our next presentation, but great presentation today. Well, now go to immunity tracker, team A026. So first, let's lower the hand of Paula. Karen, muy bien. Should be able to speak now.
Okay. Hi, everyone. Is it okay for me to go?
Yes. Yeah.
Okay. So you have COVID-19. Well, it's just a couple of weeks until you recover and you are immune to it, right? Yeah, not necessarily. According to, next slide, please. According to the World Health Organization, there is currently no evidence that people who once got COVID-19 will not get it twice. Yes, most recently, next please, Korean study shows that people might not be getting reinfected, but it is made on a group of a few more than 200 people. Now, which one to trust? How do we identify immunity? Next. Nowadays, we've been using antibodies tests. However, despite the lack of them, they can be highly expensive and not reliable enough. Next, please. And next. Next, please. Well, what if we could make so an effective, non-invasive, and reliable way of telling which people are truly immunized? Next. With your support and cute roots, we can. Next. It is an accessible solution because it doesn't rely necessarily on smartphones. Next. And the following. And it is also low cost, considering it takes only 15 cents to produce and it could be sold under 50 cents. Next. So how is that possible? The other one. We identify potentially infected people by their symptoms. Then they receive a bracelet with a QR code specific to their condition. Every time they go to an essential public place, the code gets scanned. And if somebody that has the bracelet after their immunization windows go to the stores and get symptoms, we know this person hasn't been immunized. Next, please. With this, we will provide data that could statistically determine the percentage at which people are getting immune to the disease. These bracelets are made of a thin, water-resistant, and recycled paper. Next. This is a demo of our app that we developed for scanning and based on an intuitive user experience. Oh,
And it looks like the video on the app is not accessible by folks externally, so we'll need to continue.
You can just pass it on.
Yep.
Pass it on as well, please.
Well, this one is accessible.
Yeah, you could pass it, please. Okay, so we will be using database, non-relational database. Pass it. And in the further months, we will be working on merging it with a machine learning algorithm that will provide even more accuracy to it. We have also validated a system amongst over 30 healthcare professionals. Next, please. So this is what we're here for. We're a team of 4 young, motivated girls, and we're here. That's what we're here for. We're here to build trust, build proof, and build evidence. Thank you very much.
That was an awesome presentation. It's 2 minutes for judges now.
Karen, you have the bracelet, you scan it, you send the information. What sort of data is captured in the scan so that it will prompt an intervention? That wasn't clear to me.
So the data we collect is based on symptoms, especially. So when the person goes to a drugstore or a basic healthcare unit with symptoms, the person will present it to the physician, and then it will get onto the QR code, especially that the person is a symptomatic person. Then when the person goes to a public place, the QR code will get scanned. And so we know that the place is potentially infected as well. So this is how we are going to collect data, essentially.
But once you have the bracelet, the data that is on the bracelet is static. It doesn't change anymore.
Yes, so the data is going to change after the immunization windows, which are an average of 14 days. So after that, the data will be set as if the person is not infected anymore in this case. But if the person happens to have a smartphone, like around 60% of Latin America does, this data can be updated directly on the app. But if the person doesn't have it, it will update automatically as a non-infected
That was
status.
helpful. Thank you. Now I get it. Okay, appreciate it.
Sure. Thank you. Thank you for the feedback.
That was a great question. I actually was thinking of that as well. Thank you so much. That was just the end of the 2 minutes. We're now going to go to our next team.
Okay, thank you very much.
Got it. COVID Busters. If you could please raise your hand, COVID, the presenter for COVID Busters. Do we have the team from COVID Busters on the line? Yeah, Nancy, there we go. You should be able to speak now.
Next, please.
Okay, 3 minutes.
Time is over. Well, not that bad. But anyways, how many COVID-19 cases do you know nearby you? If none, there might be you. But don't worry. Next. Our proposal is to estimate COVID-19 symptomatic and asymptomatic people in real time and in place. Next, please. The first problem is collecting data. It depends on region, the way people get information or gather data. Next, please. This leads to the question, how to identify not only the number, but also the regional risk indicators due to COVID-19? Again, it depends on region. Please, next. In any case, it's a matter of time. So previous, please. Okay. It's a matter of time. Once you get the symptoms, and hopefully you notice that, you need to get information and to get medical attention. So again, it depends on region. Please, next. Next. Please, next. Can you hear me? Okay. How to make decisions. So we have information that we need to deal with. Our proposal relies on combined existing ways to gather information. That is called the model Sentinel. And it's also given by the World Health Organization. And to add the management data platform to get information. Joining these together allows us to provide to health systems control panel to make decisions. Please, next. But not only that, it's about impact in people. So people can also get information about the risky regions depending on number of asymptomatic and also death rates. And next, please. The implementation to combine the Sentinel model with the data platform is basically the following. We already know that people can be stratified in asymptomatic, confirmed people with COVID-19 or healthy people. So we need to use this information for people to let them know to feel the surveillance in the platform and then to analyze data to provide them recommendations also in real time. Next, please.
And those are the 3 minutes of the presentation. Apologies, there was a slight delay in the flipping slides, but we now have to flip to Q&A from judges.
Yeah, that's
No questions from my side.
Okay, Diana or Miguel?
No question on my side either.
Okay.
Thank you.
No questions from Miguel either? Okay. So, sounds good. Well, thank you so much, Nancy, for your presentation. Now we're going to continue to the next team. So the AESS Universidad del Cauca. Christian, we're going to unmute you in a second. Nancy, we're going to first mute you. Lower your hand. Okay, Christian, you should be able to speak now.
Okay, next please.
Yep.
Next please. We are aware that the new conditions generated to prevent COVID-19 are affecting us daily. Next please. Only in Colombia, 0.12% of the population is infected with the SARS-CoV-2 virus, while the rest, that is so say, 99.8% of the population that is healthy still cannot go out, making them unable to go to work, study, or visit their loved ones or friends. Next, please. In fact, in our country, 18 million people must go out to work, even at the risk of not knowing if they will arrive home infected. Next, please. The key question would be, would you leave home if I told you right now that just by putting a device on your wrist, you can have complete confidence that you will not be infected with COVID-19? I think the answer will be yes. Let's not tell lies. Next, please. We all want to go out, feel the air, go for a coffee, and go to the movies again. Next, please. Today, we only see many ideas to mitigate the disease effects in already infected persons. Our solutions goes further by giving 3 vital concepts every day to everyone: information, prevention, and monitoring our health. Next, please. Let me present you Colors Health Band, an intelligent band for monitoring and indicating individual COVID-19 status. Next, please. That is, it will be able to indicate who is healthy, sick, or possibly asymptomatic by the measure of physiological variables, as well as being ergonomic and comfortable to wear. Next, please. The sensors attached to the device measure temperature, heart rate, and respiration rate. Next, please. Leading to an autonomous, highly reliable, and customizable device. Next, please. The user interaction is provided by a mobile app where your health status is displayed. Next, please. The Color Health Band collects the physiological signals or detects a near CHB. Then this data is transmitted via Bluetooth to your phone, and then the history is stored safely on the cloud. Next, please. The Color Health Band customer is someone who wants to go to work or to study or to enjoy the moments of their life as much as he can with total confidence of their health status. Next, please. Around the world, similar approaches have been made, but they mostly secure the social distancing.
Christian, thank you so much for your presentation. We've hit the 3 minutes. Let's now open 2 minutes for Q&A.
Okay, thank you very much.
Got it. Judges, please.
Quick question, how does it... go ahead, Carlos.
Sorry.
No, go ahead, you can go afterwards.
I couldn't hear the question, please.
Carlos first, then Diana.
How is this different from the other wearable solutions?
Okay, the other wearable solutions, they only deliver solutions to keep social distancing. For example, they measure the distance and they measure that you don't violate the lockdown, the national lockdown. But we want that the persons might go to the street with confidence. So if their status is green or seen by the color of the wearable device, they can go to a restaurant with that status on green, and they're going to be they're going to be in a safe environment for the rest of the people who they go with.
Okay, my question was, you are saying that the bracelet would protect you and that you could go on the streets because of the bracelet, but I think, from what I understand, the bracelet is a tracker, no, of your own state, not of the others. So how does it protect you?
Well, first it shows an indication of how your health status is, right? So at the same time, the device is also searching for someone who is near. If that person who has the COVID status on red, it's going to make an alarm, and it's going to show you and alarm you that you must remain 2 meters away from the person who has in their device a red color. So that's how our approach is thought.
And does it need data to work? Or internet connection?
Well, they receive the data via Bluetooth. Well, they transmit the data via Bluetooth to their phone, and then their phone is transmitted to internet, to the cloud.
Christian, thank you so much for the answers as well. Those are our 2 minutes of Q&A. We're going to move on to our next. Yeah, thank you. Awesome slides, by the way. Hadn't seen them. Okay, Team 829, tackling the pandemic expansion. By the way, we have 3 teams left. We'll be coming back to Team Spiderweb that was not able to present at the very end. So we're going to go through these quickly. We have just a few more teams. Thank you so much for the judges as well for bearing with a longer track. Okay, so Renato, you can speak now.
Hello. So why, imagine if you could expand the capacity of testing for COVID by more times. Next. We're now facing Latin America a very huge crisis, which means that we're facing the peak of infections and we don't have enough tests to test everyone. Next. Next. So our solution for this is multi-COVID test. It's a questionnaire and a saliva pool testing. And in a normal situation, we would test individually 30 patients. We need 30 tests, but in our system, it's a lot more. Next. So what we're gonna do, we're gonna gather samples of different people in just one spot. So if the result is negative, we'll know that everybody is negative. But on the other hand, if the result is positive, we know that at least one person in the group is positive. So we're gonna have to do more tests to determine which is positive. Next. So the conventional pool tests, we randomly separate patients in groups. And for example, in this case, in a total of 12 patients, we're gonna need 10 tests to diagnose everyone. Next. But in our system, the same 12 patients, there's 8 tests to test everyone because we are dividing the patients according to risk of infection. Next. So how do we divide patients according to the risk? We're going to apply a question for the test to determine whether the person has a high or low risk to expose to the virus according to their life habits. Next. So we divide the patients according to their risk in green, yellow, and red. So we can gather more samples in a group, for example. Next. So we're using saliva because it has shown to be very sensitive and very effective, and it's really easy to manage. Next. So let's take, for example, the third column here. In the prevalence of 3 to 16% of infected people, in a normal situation, we would need 30 tests to diagnose 30 people. But with our system, we're going to need just 12 tests to try to diagnose everyone. Next. So we intend to send our students to laboratories to increase their capacity of testing people. Next. Requirements are, we're going to do alliances with equipment providers and companies to calibrate our system and heat maps for the questionnaires. Next.
And those are the 3 minutes, Renato. We're going to go 2 minutes now of Q&A.
Renato, you have a better algorithm that is going to expand capacity. How is that sustainable? How are you going to remain in business, so to say, with the emergence of a different algorithm that is also equally powerful? How do you differentiate? How do you protect yourself going forward that you have something that is unique to you and not easily replicated? You are in mute, Renato.
Oh, thank you. So the main difference of our system is that we're going to apply questionnaires. So it's really easy to do this because before the test, someone can answer the questionnaire on their phone or a health professional and send this information to the laboratory. So that's why it's really cheaper and really faster the way we do.
If no more questions from judges, we're going to continue to our next team. Renato and team, thank you so much for this presentation.
Good afternoon.
You got it. Gen X sensors. Let's raise your hand. Sorry, I muted myself. Okay. Should be able to, there you go. You should be able to speak now.
Yeah. Is it audible?
It is audible.
Yeah, sure. Can I start?
Yes.
Good day, everyone. My name is Uday Kiran. Our team is Gen X Sensors. Our project is about Sense & Co, a smart wearable for early warning. Next slide, please. With rapid increase in COVID cases, a frontliner and a common man is discussing about the gap of the present technology in assisting the pandemic, such as inefficient tracking of the symptomized people, lack of social distancing, monitoring, prediction, and misleading information. So our target is to quickly and efficiently identify and isolate symptomized people with less workload on the frontliners. Next slide, please. Gen X Sensors solution, Sense & Co, a smart early warning wearable for monitoring and real-time tracking. Sense & Co is a smart wearable equipped with multiple sensors to identify the COVID symptoms in real time. The real-time data is being shared with a mobile application via a Bluetooth protocol. The software will categorize the people into 3 categories, such as highly, moderately, and leastly symptomized, based upon the symptoms. Next slide, please. Our device is a fusion of multiple nanosensors with high accuracy. It measures temperature, oxygen levels, blood pressures, heart rate, and cough of a particular person. The data is shared in an encrypted form with a 2-way authentication. The machine learning algorithm will categorize the person if the parameter count, such as 2 or 3 out of 5, is above the threshold over a period of time. Next slide, please. So here is a proof of concept developed in the last 2 days. It consists of a microcontroller, temperature sensor, cough detection sensor, heart rate sensor, and a Bluetooth module. Next slide, please. The mobile application helps in visualizing the real-time hotspots people according to category. It configures them as red, orange, and green spots on the map. The personal data will be encrypted, and it is required a 2-way authentication for data sharing. The mobile application will assist in 2 modes for frontliners as well as for the public. For the frontliners, it helps in tracking location history of a symptomatic or asymptomatic person on access, and helps in monitoring patient health conditions and monitoring neighborhoods for risk profiles. And for the public, it helps in alerting if he or she is near an infected person or area, and monitor his or her symptoms in real time. It provides restriction on accessing others' data. Next slide, please. So here are the advantages over the competitors: real-time data transfer, real-time tracking, alerting, fake news suppression, and cost-effective. Next slide, please. So the cost and revenue and the time plan of the proposed solution has been shown here. The proof of concept has been developed, and the prototype has to be developed right now.
We've come to the end of the 3 minutes. We now are going to switch
it's
to.
the last slide. Yeah.
Sounds good. We're going to switch to Q&A. 2 minutes.
Sure.
Judges, please.
Can I ask one of my team member, Dr. Pal, to take on this?
Sure. Let's have Dr. Pal to raise his hand. In the meanwhile, let's get questions from the judges.
Sure, definitely.
So similar to the question to the previous presentation, what's the minimum number? Like what's the threshold, the tipping point over which a percentage of the population needs to have this technology for it to actually benefit society and help us prevent and know where infected people are? And how would this be implemented? Through a government? Would it be mandatory? How are you guys envisioning this?
Can I ask, I mean, one of my teammate, Dr. Paul, to take over this? I mean,
Yes. Yeah. Sure. This can be help in government organization or authorized government organization and the health care facility, airport, railway, where many publics are there. This wearable is a repeated use. It can be used number of times. So it can be used all the people who are symptomatic, asymptomatic, for their, even it can be shown their own health status, and they can be judged by their own. And even this whole, whatever data it will come, it will go to a designated data collection center, so that this authorized agency, they can track the area or the population where these more symptomatic patients are there, and they are wherever. So it can be used in mass population.
Sure. If no more questions from the judges,
Please.
We'll continue with our next team. Thank you so much, team. And those are actually just the 2 minutes right there. So going.
Thank you very much.
You got it. So this is not the last presentation. After this presentation, we're gonna go back to Spiderweb. So team Spiderweb, please make sure to have your presenter ready. If not, sadly, we're gonna have to forego to presenting today, sorry, not tonight. Okay. So for Prevent Tech, we have TRK. The unmuting is not. For the presenter for, I think Uday and Dr. Powell were both previous teams. For the main presenter for Prevent Tech, could you raise your hand if you're on the line? Habiba, you cannot raise your hand. I'll find you. Okay, there you go.
You know, adrenaline is a really funny thing. Honestly, I mean, I can't breathe right now. And the same thing is happening to flocks of Latin Americans. And we all know that it's not because of public speaking. Next slide, please. Latin America is the epicenter of the COVID-19 pandemic, with so many devastating losses, yet so little resources to mitigate against them. Switch slide, please. There isn't nearly enough testing, with only 0.0002% of Mexico's population being tested, allowing for masses upon masses of people to get sick, to suffer, to die. Next slide, please. Preventech is a miracle app. Why? Because it identifies, tracks, and prevents COVID-19 cases by notifying users of their risk of exposure to the virus. Next slide, please, and play the video. Thanks. So how does it work? Preventech collects the location data of its users, which is kept on their device unless they show symptoms or test positive for COVID, in which case this data is uploaded to our servers. Only coordinates are shared, and data is kept 100% anonymous. The app then alerts any users who have come in contact with that infected user. According to our recent market study, 78.6% of users wouldn't mind sharing their location data to prevent COVID spread. I'd also like to add that what you just saw isn't a bunch of random screenshots. It's actually a fully functioning prototype. Pretty cool, right? Next slide, please. Colored alerts will inform users of their risk. A red notification will be sent to contacts of a confirmed case, and a yellow notification will be sent to contacts of a suspected case. Users will also be provided with official resources on COVID. Next slide, please. Beyond being a notification system, Preventech users can be proactive in combating coronavirus through the app's map feature. Using data on potential unconfirmed COVID-19 cases that has been gathered through our app and official resources, Preventech provides a heat map of a user's area and the surrounding communities, and this is to give better information on the risk of traveling to certain hotspots. Also, Preventech will allow for better prediction of the number of cases in an area, which allows us to alert hospitals and governments ahead of time in case of a certain case sustainable as it is free to download and very user-friendly. Right now, downloading the app is going to be voluntary and we don't plan on changing that. Our team, made up of people from all around the world with diverse skill sets, also made sure that the app is open source, which means that it can be implemented by anyone from anywhere. And people can see for themselves how we're handling their data. I would also like to stress that we only collect necessary data and terminate it on a monthly basis. Next slide, please. A Preventic is a simple solution to an increasingly complex problem. It allows individuals to gain a better understanding of their own risk and the risk in their area. It's also easy and quick to implement and more than feasible. So choose Preventic, or else some other disaster that you could have preventect will happen. Thank you.
Thank you so much, Saliva. That was a great presentation. Now 2 minutes.
Thanks, Habiba. That was a great presentation. The question is similar to the previous presentation. What's your target group, and how does this work if you can't reach most of the people? I'm thinking of smartphone penetration. I'm thinking of mandatory versus voluntary uptaking of these apps. What are your thoughts on that for scalability?
I think my teammate Jacobo would like to take the questions. Is that okay? I'm sorry, can you repeat that again?
Okay, so what we're doing to address these issues is, well, we are trying to roll this out in a country where there is sufficient smartphone penetration, and even if we only address a portion of the population that does have smartphones, it will have a huge impact because we can mitigate the spread of COVID-19 and get more accurate data that will allow us to predict searches in cases and when the peak will be.
Thank you for that, team. Do we have any other questions from the judges?
No, I don't have a question. I like a lot the fact that it's kind of a crowdsourced, that is anonymous, that doesn't really alert the crowd around you that you are infected, because chances are that if that's the case, people will not actually wear it. So being passive, I believe, it makes it far more efficient than the old solution.
Awesome, awesome. Thank you, Carlos. And with that, we're going to close out this presentation. Thank you, Jacobo. We lower your hand. So we have one team, well, that wasn't able to present. Want to ask if the team Spiderweb is available to present now. If you are, please raise your hand. Okay. Catherine.
I'm not going to use my camera right now.
Yes, great. Let's do that.
So I'm going to say click every time I need.
Great. Let's go. You should start.
But I don't see the presentation.
Because I'm not sharing the right thing. Don't worry, I won't count this as part of your timing. So, okay, here we go.
I still see the other one.
Nope, you should see it now. Do you guys see your presentation?
Yeah.
Great.
Click. In Latin America, we have one problem in this pandemic. Click, click. We either die from hunger or from the virus. We need to go out and work. Click, click, click. Because most of our countries are known for our workforce, products, or informal workers, and we're getting tested only if we get symptoms having the silent risk of asymptomatic cases. Click. The solutions that are being created are apps or gadgets that track live our movements and let us know if someone that had interacted with is infected so we can reach help. Click. This solution is targeted to cure. Click. But what if we give people the tool to prevent and give companies the guarantee of a healthy and safe workplace? Click. Let's imagine you have 10 workers on your company. Click. Oh. And this is how they interact today. Click. And that flow is going to change tomorrow. Click. If you get a positive and you're trying to track the possible movement of the virus, you'll get to need to close and quarantine. But if you use a tool to plan a unique way of interaction flow between your workers, click, and you're able of tracing it, we will have an improvement on our reaction possibilities of a COVID positive. The first positive is asymptomatic. We can locate the first degree interaction and mark them as possible positive asymptomatic COVID cases and ask for a test. The people that are second degree interactions are going quarantine until we have the results of a possible asymptomatic patient. If we have asymptomatic positive, their second degree needs to be tested too, but the person with a third degree does not need that. And that way you can still have 60% of your company working after the first COVID positive case. To accomplish this, we are going to develop a system to process all the information and an interface that can be accessed by a web browser and an app. Companies are going to see the information on a web browser and workers on an app. To introduce, click the information and recognize the type of interaction they are submitting, click. A page like this will show. I can introduce my information and enter my workers' code for security reasons. If I want to submit information about my family, I need to put my name, code, type of social interaction, name or nickname of the person, their phone number, and the frequency I'm going to interact with. So for example, if I want to introduce my family, I can put the information about my parents in yellow, niece and nephew in orange, and brother and sister-in-law in red. So if my brother is positive, I know that I am not a threat for the company. Luckily, click. With our service, we are going to be able to identify cases and isolate them using the interaction degree systems. Also, we're going to be able to track and manage asymptomatic cases.
Hi, Catherine. Those are the 3 minutes now. We're gonna go to Q&A.
Okay.
2 minutes.
Catherine, thank you so much for the presentation. I really loved your pitch at the beginning, talking about the workers that cannot afford to work from home. And I think most of them in Latin America would be informal workers. So I was thinking of how would you think, like thinking about the problem that you mentioned at the beginning, how can your application be stretched to perform a solution for these people that cannot afford to stay home and are part of the informal system, so the company cannot pay for this kind of solutions? There is no company.
Our idea is first to sell this product as a package of security guaranteed to the companies, bigger companies, and then we can go and give this service to other people that do not have, for example, access to internet. And that way, if you saw, the confirmation code was sent by SMS, and that network can be done via SMS. So it will be good for people that does not have access to internet.
Great. Okay. If there are no more questions, we're gonna wrap up our session with that. I'm gonna change my screen to go back to the previous presentation. Great. So with that, I want to first of all thank the judges for judging for a incredibly, I think, exciting track, incredibly important track, and also the longest track of the event, by the way, because I'm looking at what's going on with every other track, and we've had the most teams, the most ideas. So thank you for putting in the time, the effort, both judges and participants. With that, we will wrap up this session. The next is happening in 30 minutes. Judges will now huddle to deliberate to identify the 3 winners of this presentation, of this session. And everyone else, first of all, congratulations. You did an amazing job throughout the weekend. Congratulations for putting in the time of not doing something great, starting something great. Because every one of these projects should continue to have an impact. Our last event happening in 30 minutes at 4 p.m. Eastern Daylight Time, which is the same time as New York City. Think of it as like that. And the link is available on Slack, and you see it here as well to join that webinar. We'll be moving there shortly. I'll quickly say it in Spanish. Gracias a todos por participar. Increíble fin de semana, increíble manera de no hacer algo increíble, pero empezar algo increíble. Porque todos tenemos que continuar trabajando en los proyectos que hemos desarrollado este fin de semana, que ustedes han desarrollado este fin de semana. El próximo evento sucede en 30 minutos en el Awards Ceremony y será el webinar está disponible en Slack y en el Participant Guide. Con eso voy a cerrar esta sesión. I'm going to close this session. If we have Enrique, could we say that in Portuguese just to make sure no one...
Claro, foi um prazer ter todas essas equipes aqui. A gente espera que vocês, não só os vencedores, mas todos continuem os trabalhos, né, após o hackathon. A cerimônia de encerramento vai acontecer a partir das 5 horas, né, daqui a 30 minutos. E o link está no Slack, também foi enviado aqui no chat. Espero que vocês aproveitem tanto quanto a gente. Obrigado.
Obrigado. Okay, perfect. So now we're gonna wrap up the session for judges. I'm gonna post a separate Zoom room for us to jump in that Zoom room in the Slack channel that we have shared. Slack. Everyone, thank you so much. Bye-bye.